Alright, try not to cry, but this is the last two pre-labs that we have to go over, and then we're all done. Your lab final is going to be on Monday, April 27th from 7 to 9, and this material will be on the final. We'll start with the renal physiology. Number 1 said, trace a drop of water through the urinary system, beginning with the plasma in the afferent arteriole and ending with the external urethral orifice. So we'll start with the nephron, starting at the renal corpuscle. Here's the afferent arteriole. So this filtrate enters from the afferent arteriole into the glomerulus, and then from the glomerulus it goes into the Bowman's capsule space. After Bowman's capsule space, it goes into the renal tubule, and it starts with the proximal convoluted tubule. So proximal convoluted tubule then leads to the descending limb of the nephron loop. Then we have the loop of Henle. Then we have the ascending limb of the nephron loop. Then we have the distal convoluted tubule. Distal because it's further away, convoluted because it's not a straight line, which leads to the collecting duct. And then the collecting duct ends at the renal papilla, and this will be continued on the next slide. So we ended with the renal papilla right here, and then the renal papilla empties into the minor calyx, and then the minor calyx empties into the major calyx, and then the major calyces all lead to the renal pelvis. And the renal pelvis exits through the renal hilum into the ureter. So then the ureter goes down to the bladder. All right, so here's the kidney, here's the ureter. The filtrate then is going to go down to the bladder. And then from the bladder, it exits through the urethra. And if we want to get real fancy about it and nitpicky, then we can actually separate the male urethra. It goes through the prostatic urethra first, then the membranous urethra second, and then through the penile spongy urethra last. And then it exits through the external urethral orifice. All of that belongs with number 1. Question number 2 says, Sylvia is suffering from severe edema in her arms and legs. Her physician prescribes a diuretic, something that will increase the volume of urine produced. Why might this help to alleviate Sylvia's problem? Now you could just simply say that a diuretic reduces the amount of fluid in your system. It makes you pee more, but it's a little more complex and complicated than that. What does the diuretic do? The diuretic is basically going to make you eliminate more water. How does it do that? By closing the aquaporins. The aquaporins that are in the distal convoluted tubule and the collecting duct. So it's going to decrease. Let me get my little pen working here. Whoops. So it'll decrease aquaporins so that your urine is more dilute. But you could also look at it from a different angle. As the urine becomes more dilute, it's going to make the blood hyperosmotic because we're losing more fluid from the filtrate. So we're losing more filtrate, and so the blood becomes hyperosmotic. So then it's going to draw the fluid out from the tissues where there's the edema because it's going to go towards the hyperosmotic environment into the cardiovascular system. So basically what we're doing is it's creating a hyperosmotic blood so that the fluid is going to be pulled back into the capillaries and away from the tissues, and so it lessens the edema. Another way of looking at it is saying that increasing the volume of urine produced would decrease the total blood volume in the body, and then that in turn would turn around and lead to a decrease in your hydrostatic pressure, so your systemic blood pressure would go down as well. Number 3 says Ginger, an undergraduate, has normal carbon dioxide levels, high hydrogen ion levels, and low pH and bicarbonate levels. What type of disturbance is Ginger suffering from, and what might cause this? And then it asks, if her carbon dioxide levels are elevated, would your answer change? And then it wants you to explain. Well, since it tells you that she has high hydrogen ion levels and low pH, they go hand in hand, that is an acidosis problem, right? Because the more hydrogen ions there are, the lower your pH, which makes you acidotic. Now, is it metabolic or respiratory? Well, at first, she has normal carbon dioxide levels, So the respiratory system is not involved, so that would make this a metabolic acidosis, not respiratory. And then later it says, if her carbon dioxide levels were elevated, would this change your answer? Yes, it would change your answer, because if the carbon dioxide levels have been elevated, then it could also possibly be a respiratory acidosis. The acidosis doesn't change. What we're trying to determine is whether it's respiratory or metabolic. So they look at your carbon dioxide levels. If the carbon dioxide levels are normal, then it's metabolic acidosis. If your carbon dioxide levels are elevated, then it would be most likely a respiratory acidosis. Then, just as a side note, metabolic acidosis could be caused by ingestion of methanol or aspirin or antifreeze causes a metabolic acidosis. Respiratory acidosis can be caused by drugs or alcohol, and it also could be caused by increased resistance with the asthma that we looked at with the case study last time with the asthma attacks case study. The most common cause of respiratory acidosis is COPD, which is chronic obstructive pulmonary disease. So ketoacidosis happens whenever the liver is producing a lot of ketone bodies. The ketone bodies are used by the nervous system as a source of energy to make ATP whenever there's not enough carbohydrates. This is one of the things we looked at when we looked at a diet that consisted of just protein. So the protein-only diet, the Atkins diet, could cause a problem in the long term because your liver is producing ketone bodies, and ketone bodies mess with your pH. It lowers your pH, which means you have an elevated amount of hydrogen ion. Well, the respiratory system, how does the respiratory system compensate for an acidosis state? It does so by hyperventilating. So why is she breathing and gasping? Let's talk about hyperventilation. Hyperventilation means is the deep and gasping breaths. It's going to increase your oxygen levels, but it's going to decrease your carbon dioxide levels. And whenever you decrease your carbon dioxide levels, it raises your pH. So why is she breathing deep and gasping? It's because her body is getting rid of extra carbon dioxide, which is going to shift her pH, raise it back up to take care of her ketoacidosis. So in number 5, this is to indicate and explain how Sally's blood pH, bicarbonate, and carbon dioxide levels react by indicating whether they increase, decrease, or there is no change. We'll start with ketoacidosis. If ketoacidosis has just developed, how does that affect the blood pH, the bicarbonate levels, and her levels of carbon dioxide in her blood? Whenever I go over this in lab, since we didn't do it this way, everything got messed up and we're doing anything online, I usually don't stress the bicarbonate too much. I'm going to check it on your pre-labs that you turned in, but there won't be any part of that on the test, just the bicarbonate. But the blood pH and the carbon dioxide levels could very well be on there. But if ketoacidosis has just developed, by definition, that means the blood pH has decreased. So blood pH is going to go down. How does that affect the bicarbonate levels? Well, the bicarbonate levels are also going to decrease because it has to do with the shift in the carbonic acid reaction, which I don't really go over too much. But anyway, blood pH goes down, so will the bicarbonate levels, and then the carbon dioxide levels are unchanged because there is no respiratory compensation yet. That's going to be the next part. So blood pH decreases, bicarbonate levels decrease, carbon dioxide levels have not changed, they're unchanged. So what changes whenever the respiratory compensation occurs? Well, then the blood pH is going to start to increase because now she is hyperventilating. The bicarbonate levels are going to decrease because it's going to shift the carbonic acid reaction to the right. And then the carbon dioxide levels are going to also decrease because with respiratory compensation for ketoacidosis is hyperventilation. So now let's look at what happens with renal compensation. After a while, it starts to occur. With renal compensation, blood pH is going to increase. Now with renal compensation, we are reabsorbing or absorbing bicarbonate from the filtrate, so that was also going to increase. And then the carbon dioxide levels, since renal compensation is occurring, then respiration returns to normal. So your carbon dioxide levels are going to increase. Now, why are they going to increase is because up here with respiratory compensation, carbon dioxide levels decreased. But once the kidneys take over and start to compensate, then your carbon dioxide levels will go back up, so it also increases. All right, the acid-base chart, which is not as hard as it looks. What you're to do with each one of these conditions is you're supposed to just tell me, is it a high hydrogen ion concentration or a low hydrogen ion concentration? And in that case, does that mean the pH is going to be high or the pH is going to be low? And then you take a look at each condition and then you decide, is it a respiratory problem or is it a metabolic problem? Well, if it's a respiratory problem, then the compensation is going to be renal. If it is a metabolic problem, then the compensation is going to be respiratory. So let's look at diabetic ketoacidosis. With diabetic ketoacidosis, it tells you that you're acidotic, which means your hydrogen ion concentration is going to be high, which means your pH is going to be low. Anytime you have a high hydrogen ion concentration, then your pH is going to be low. So, is diabetic ketoacidosis a respiratory problem? No, it's a metabolic problem. And it tells you acidosis in the actual name of it, so it's going to be a metabolic acidosis. If it's a metabolic acidosis, then the compensation is going to be using the respiratory system. So, hyperventilation, hypoventilation. We want to lower our carbon dioxide levels since we're acidotic. And to lower your carbon dioxide levels, you hyperventilate. So again, diabetic ketoacidosis. That is when your hydrogen ion concentration is high, which means your pH is low. This is a metabolic acidosis problem, so the compensation is using the respiratory system by hyperventilation, which is going to lower your carbon dioxide levels and bring your pH back up. Now let's talk about prolonged vomiting. Prolonged vomiting means you're losing a lot of the contents, especially all the contents in your stomach, including hydrochloric acid. So it makes you alkaline if you've been vomiting for too long. So it's going to lower your hydrogen ion concentration, which means your pH is going to be too high. So anytime your hydrogen ion concentration is lowered, then it raises your pH. So prolonged vomiting, is this a breathing problem or a metabolic problem? It's going to be metabolic, so it's a metabolic alkalosis because our pH is high. So the compensation is going to be using the respiratory system. So if we're going to use the respiratory system, how are we going to lower our pH? We do that by hypoventilation. With hypoventilation, your carbon dioxide levels will rise. And when your carbon dioxide levels rise, then your pH is lowered. So prolonged vomiting. You have a low hydrogen ion concentration, which means your pH is high. This is a metabolic alkalosis problem, which is compensated by hypoventilation in the respiratory system. The next question is about, or the next column is about barbiturate poisoning. Well, what is a barbiturate? A barbiturate is a class of sedatives or a sleep-inducing drug. So it's like a downer. It's a depressant, so it makes you sleepy. Well, with barbiturate poisoning, that means you've taken too many. Whenever that happens with barbiturate poisoning, it raises your hydrogen ion concentration. And if it raises your hydrogen ion concentration, that means your pH is too low. Now with barbiturates, whenever they are suppressing the nervous system, they're suppressing your breathing. So barbiturate poisoning is actually going to affect how you breathe. It's going to cause hypoventilation. So this is going to be a respiratory problem. Now, is it acidosis or is it alkalosis? Well, if the pH is low, it's an acidosis problem, so this is a respiratory acidosis. So let's make sure we understand why. It's because with barbiturates, it is suppressing the nervous system, and it's a depressant. So it's making you breathe shallow. And with shallow breathing, that's hypoventilation. So your carbon dioxide levels are increasing, which is going to make you acidotic. So this is respiratory acidosis. Since this is a respiratory problem, then the compensation is going to be using the renal system, the kidneys. Well, how do the kidneys raise your pH? It raises your pH by excreting excess hydrogen ion. Now, as it gets rid of the hydrogen ion, then it will help raise your pH back up to normal. So barbiturate poisoning. It is a respiratory acidosis. It's a hypoventilation problem, which means you have a high hydrogen ion concentration, which means your pH is too low. If it's a respiratory problem, the compensation is using the renal system, using the kidneys. Well, how do the kidneys compensate for a low pH? By excreting excess hydrogen ion into the filtrate. As it secretes the hydrogen ion into the filtrate, it helps raise your pH back up to normal. And then we have emphysema. Emphysema is a breathing problem. With emphysema, the shape of the alveolus has changed, and we've decreased the surface area available for gas exchange. And if we decrease the surface area available for gas exchange, then we are going to have low oxygen levels, and we're going to have higher than normal carbon dioxide levels. If we have higher than normal carbon dioxide levels, it messes with your pH. It lowers your pH. So with emphysema, it is a respiratory problem. It is a respiratory acidosis problem because our carbon dioxide levels are too high. If our carbon dioxide levels are too high, that means your pH is going to be low. If your pH is too low, that means your hydrogen ion concentration is too high. So hydrogen ion concentration is high with emphysema, your pH is lower, and it's respiratory acidosis. Since it is a respiratory problem, compensation is going to be using the kidneys, the renal system. So how do we compensate for a low pH using the renal system? It is by excreting excess hydrogen ion into the filtrate. So compensation by kidneys is secreting hydrogen into the filtrate, which will help raise your pH. This is just like what we did with barbiturate poisoning. Whenever we feel like we have a sour stomach, it's too acidic, or we get heartburn, then we take something called an antacid, like Tums or Rolaids. These antacids will then help combat the acidity of the stomach. With an antacid overdose, that means that you have produced too much bicarbonate buffer in your system, which is going to raise your pH. So antacid overdose is going to make your pH too high. If your pH is high, that means you have a low hydrogen ion concentration. They go hand in hand. So the antacid is going to bind to the hydrogen ion, which is going to decrease the concentration of hydrogen ion in your system, which means your pH is going to be high. Now, taking too many antacids, is that a respiratory breathing problem? No, it is a metabolic problem. This is going to be metabolic alkalosis. So if we have a metabolic alkalosis, the compensation is going to be using the respiratory system. So if we need to raise our pH, how do we raise our pH using our breathing respiratory system? By hypoventilation. Because whenever we hypoventilate, then we're going to increase our carbon dioxide levels. And whenever we increase our carbon dioxide levels, then we lower our pH. So antacid overdose. It is a metabolic alkalosis, which means our pH is high, hydrogen ion concentration is low, respiratory system is going to hypoventilate to compensate. All right, this one straight up just tells you it's hyperventilation. When you're hyperventilating, and you're breathing too fast, your oxygen levels are going to go high, your carbon dioxide levels are going to go low. Well, since your carbon dioxide levels go low, that has a direct correlation to your hydrogen ion concentration. So hyperventilation creates low hydrogen ion concentration, which means it creates a high pH. It puts you in alkalosis state. With hyperventilation, it's definitely a respiratory problem, so this is a respiratory alkalosis. And with the respiratory alkalosis, then you're going to compensate using the renal system. Using with the kidneys, what they're going to do is reabsorb excess hydrogen ion from the filtrate. So reabsorption of hydrogen ion to help lower your pH. So hyperventilation is a breathing problem. Whenever you're hyperventilating, your carbon dioxide levels drop. When your carbon dioxide levels drop, then your hydrogen ion concentration drops as well. So it's low hydrogen ion concentration, which creates a high pH. And with this being a respiratory problem, is respiratory alkalosis. So the compensation is the renal system using the kidneys, and they're going to reabsorb hydrogen ion from the filtrate. And this next one's a little tricky. It's the thoracic and abdominal surgery. Whenever you're having surgery, they have an artificial respirator. They're forcing air into your lungs. They're forcing air into, but there's a chance that there's not a lot of air coming out, so your carbon dioxide levels will rise. So if your carbon dioxide levels rise, your hydrogen ion concentration also rises. So with thoracic or abdominal surgery, if it's been extended too long, it's going to raise your hydrogen ion concentration, which means your pH is going to get low. So with this, since it is forcing air into your lungs as a respiratory problem, it is a respiratory acidosis. Since it is a respiratory acidosis, we're going to have renal compensation. The kidneys will compensate by excreting excess hydrogen ion into your filtrate. So again, with thoracic or abdominal surgery, they're forcing air into the lungs, and then normally it will relax and allow your lungs to go back to normal size and allow you to exhale. But with long surgeries that take longer than normal, your carbon dioxide levels will slowly start to rise. So as your carbon dioxide levels rise, that means your hydrogen ion concentration also rises. So if you have a high hydrogen ion concentration, that means you have a low pH. Since we're talking about breathing, this is a respiratory acidosis problem. So the compensation is going to be using the renal system, using the kidneys, by excreting excess hydrogen ion into the filtrate. All right, the last one is just flat out kidney failure. With kidney failure, you're not producing any filtrate. And one of the functions of the kidneys is to excrete hydrogen ion into the filtrate because it's helping to balance your pH system. Well, if you're unable to get rid of excess hydrogen ion, it's going to start to rise. So with kidney failure, your hydrogen ion concentration rises, which means your pH is going to lower. And since it is kidney failure, this is a renal metabolic problem, so it is a metabolic acidosis. If it is a metabolic acidosis, then the compensation is going to be using the respiratory system. With an acidosis problem, using the respiratory system, you want to breathe off more carbon dioxide. So, is it hyperventilation or hypoventilation? To breathe off more carbon dioxide, it is a hyperventilation compensation. So kidney failure will increase your hydrogen ion concentration, which will lower your pH. This is a metabolic acidosis problem, so compensation is by hyperventilation. All right, hopefully you got all that on the renal physiology and also the acid-base chart. If you have any questions about it, just email me. You already have the study guide for the final. Remember, your final is on Monday, April 27th from 7 to 9. Most of the questions will be multiple choice or true-false, and then there will be just a few where you might actually have to fill in a short answer.